Hello all, welcome to my channel. In this video we will learn what is healthcare and what is public nutrition. So what is health we have already discussed. Health is a complete state of physical, mental, social well-being, not just merely the absence of disease or infirmity. So before we understand what is healthcare status in the community, we need to understand the word community. So community may be defined in the narrower sense as a group or collection of group that inhabits the limited geographical area whose members live together in such a way that they share the basic condition of common life. So always community indicates the group of people. A group of people, there is no existence of any community without people whose interests are based on the mutual dependence and cooperation. So that we call it as a community. So before we understand what is a health care, community health and nutrition go hand in hand. Nutrition is a science that is related to food and its relation to health, and it is the science of nourishing the human body. So community nutrition or public nutrition always focus in or concerned with the improving the nutrition in the population in both poor and industrialized countries. In the developing countries, the public nutrition plays an important role in the development of the country. So what are the activities of public nutrition? So an understanding and rising awareness nature causes the consequences of nutrition problems in the society. There are different nutrition problems which the developing countries faces, and understanding what are the nutrition problems and how to tackle the nutrition problems and what are the consequences of nutrition problems in the society, that has to understood in the public nutrition. It may be include the epidemiology, including monitoring, surveillance, and evaluation of nutrition problems, policies, and what are the programs are there in the country to address all these nutrition problems. Nutritional requirement and dietary guidelines of the population, that is understood in the part of public nutrition. Programs and interventions, their design, planning, management, and evaluation is done under the public nutrition. So community nutrition and community-based programs are also part of public nutrition. Public education, awareness of the public, especially in the nutrition education and behavioral changes, are the points we have to consider under the public nutrition. So timely warning and prevention, eradication, mitigation of emergencies, including survival of ration distribution, advocacy and linkage with such as a population and environmental concerns, public policies, programs relevant to nutrition in several sectors, example, economic development, health, agriculture, education, etc. Now let's see what is healthcare. So we all know that health is a fundamental human right, and thus it becomes the imperative for the state to assume the responsibility for the health of the people, where we are talking about people or the community health. In order to achieve this objective, the national government globally are engaged in providing the adequate health care to their people. So by the care must be given under the different sectors. Now let's see what is healthcare. Healthcare involves much more than just medical care, and it can be defined as multitude of the service provided to the individual or the communities by the agent of health service or the professional for the purpose of promoting, maintaining, monitoring, or restoring the health. So health care can be viewed or discussed under the or delivered in India under the three main headings, that is primary healthcare, secondary healthcare, and tertiary healthcare. Primary health is the first level of contact to an individual or the family and the community at the national health system. It is possible to deal with most of the health problems of the community effectively at this level. So in India, these services are provided through the network of called as primary healthcare centers, which we call it as a PHC, and their sub centers are called as S, SCS. They are all spread across the countries, and their functionaries involves dispensing the service include multi-purpose health workers, village health guides, trained birth attendants, DIs, and are the some of the people who work under the primary health care system in India. So 90% of the services or the people come in contact with the primary health care centers in the India. So if we see the what percentage of secondary healthcare is 9%. Secondary healthcare involves the general hospital services, which is most complex health problem of the community are resolved under the secondary level through the district hospital or at the community health centers. So this is you can call it as a more upgraded level. The diseases or the cases which cannot be handled under the primary health care centers will be next sent to the secondary health care setups. Next we have tertiary health care, or the service provided is a specialized hospital. The percentage is 1% in India. This is highest level of healthcare available for the community for dealing with the most complex type of health problems which cannot be solved under primary and secondary levels. The institutions involves providing the requisite facility care including in the medical colleges, all Indian institute, regional hospitals, specialized hospitals, or the apex institutes are uh, some of the hospitals which are into the tertiary healthcare system. So, what is the role of uh, public nutrition in the healthcare? So, the nutrition is important, though not only it is a determinant of health of the individual, but it is a root cause of many health problems of the community and can be traced due to the faulty nutrition, which may be deficiencies or excessive eating or malnutrition. All these are the problems which are because of the imbalance in the nutrients. So hence nutrition can be viewed as a subset of health, since the attainment of health for all is a universal goal of the nation and communities. So public nutrition has to be the integral part of any strategies designed to achieve the goals. Thank you. This was about the introduction. So in the intervention, what are the intervention programs of the community, which is a very important topic in the community nutrition, will be I will be uploading in the coming days. Thank you.